Thank you all for joining us today for another episode of our podcast, Moving to Value Unscripted. My name is Dr. John Rodas, and I'm a recovering ex-hospital president and am proud to be the president of the Moving to Value Alliance. The Moving to Value Alliance, MTVA, a 501c3 nonprofit, is a multi-stakeholder grassroots organization whose purpose, put simply, is to foster a community that aims to create a value-based healthcare ecosystem with high-quality outcomes at a reasonable cost for plan sponsors and their members, beneficiaries, or employees. Our community has grown substantially over the past few years. We started in Connecticut, but now have nearly 1,000 stakeholders from more than 40 states all over the U.S., and our members include many value-based influencers. I want to thank our members who make this presentation possible. We'd like to give special recognition today to our trade member, Connecticut Joint Replacement Surgeons, LLC. We're joined today by my fellow board member, Lisa Trumbull, and MTVA Executive Director, Laura Watson. Lisa Trumbull is the CEO of Sohn Health, Southern New England Healthcare Organization, a physician-led, clinically integrated delivery system in Connecticut and Massachusetts. Laura Watson is a journalist with experience reporting on healthcare, antitrust, and regulatory news. Our special guest today is Al Lewis. Al has been working in the population health and wellness outcomes space for decades. He is the founder of Quizzify and author of the book, Why Nobody Believes the Numbers, which was named 2012's Digital Health Book of the Year by Forbes. He founded the learning platform Quizzify in order to help address the problem of health illiteracy. Quizzify's programs make complex health information easy for people to understand and use, guided by the principle that wiser employees make healthier decisions, kind of using a Jeopardy-style Q&A. We're excited to have Al join us today to discuss GLP-1 weight loss drugs and how educating patients on GLP-1s can reduce wasteful spending and lead to better outcomes. Welcome to Moving to Value Unscripted, Al.
Well, thank you very much for having me on.
Al, we're probably around the same age, I'm guessing, and we've all come to this place from a very different paths, and your path, like mine, I would say, is not traditional. So our listeners love to hear a little bit of the backstory of how you got to where you are. I mean, you went to Harvard, studied economics, you went to Harvard Law School, and somehow I don't think, starting Quizify or writing books on healthcare economics seems to be natural. So tell us how you got from there to where you are today.
How did I get to Quizify? Well, as you probably remember, because we went way back and you mentioned my book, the first thing I did was or not the first thing, but the first relevant thing for this group was I get credited sometimes with inventing disease management. I was very early into disease management. I was also very early out when I was the first person to figure out none of this stuff worked. And then I got into wellness because I thought, well, everybody says wellness works, but it turns out wellness is way worse than disease management. It can actually harm people and cost a fortune. So and I ended up taking out a lot of people's wellness programs and disease management programs, but it turned out that that there's a lot less money in taking things out than putting things in, right? So, I'm looking around at what to do, and I have a whole blog post on this. And I had also published an economics book, an economic policy book, because as you mentioned, I taught economics at Harvard for a while with an emphasis on healthcare and other policy. And the book didn't sell very well.
That's the
But
cracking health cost, that one?
no, this one I don't even know if you can still find it. It's called "Why the Heck Aren't We Already Doing This Stuff?" And it says 12 policy ideas even a congressperson could understand. Some of them have actually happened. Like one of the ones we talked about was how real estate commissions should be deregulated, even though they weren't technically regulated. It was pure price fixing. Well, they've done that. They did that very recently. Well, in any event, one of these copies of the book somehow made it into the hands of the guy who runs the National Public Radio affiliate in Washington, D.C., which is their biggest affiliate. So he contacts me and says, we'd love to try to make a show out of this. What we would do is you said, you're not going to have a budget, so you'd have to host it. Fine, and then we can't pay you, we'll pay your expenses to come down. And we'll have like a Democratic, luminary and a Republican luminary. And this was what the book was about. The book was about finding things that both parties could agree with. And listeners would call in with policy ideas. And if both sides would agree, they would introduce the legislation. Okay, so it's a
Fascinating.
great concept for a show. It's a long story why I didn't catch on, but in any event, so I'm down there, I'm hosting, I've been on radio shows, I'm on podcasts, I do this stuff all the time. It's a lot different when you're actually hosting a radio show because you got all these little lights and buttons, and you got the producer in back of the glass screen there, and all sorts of stuff going on. So I'm kind of fumbling my way through it. After the first episode, the producer says, "Okay, well, for a first episode that wasn't bad. You'll sound better when you get over your cold." And newsflash, John, this is the way I always sound. I always sound. And somebody had told me that I had a deviated septum like years ago, and I didn't think twice about it. But now I think, my God, I'm going to lose my gig if I don't get this fixed, right? So I call back. I'm down in D.C. I call back to my primary care doc in Boston, Greater Boston, and I tell her the story. And in those days, you could see specialists.
Yes.
So she gets me in to see an ENT the next Monday, right? So the
Wow.
ENT,
That's
yeah,
big.
yeah,
Three
I know.
weeks
This
is
is well, this is
3 months is
ancient
usually
history.
pretty
This is
good.
2012. This is ancient history. So the ENT sticks the scope up my nose and says, "Well, I said I thought I had deviated septum, which is, of course, why I've seen the ENT." She said, "Well, your deviated septum's the least of your problems. You've got polyps." I didn't even know what the hell a polyp was,
There you go.
So she says, mind you, this is all taking place in literally about 6 or 7 minutes. She says, well, there's three things we could do. We could operate, take them out, they could grow back and whatnot. We could do a 3-week course of antibiotics, or we could do a 3-week course of antibiotics plus Flonase, and I'm going to want a CAT scan. So I say, well, shouldn't we do the most conservative thing first? And she says, quote unquote, well, you could, like only an idiot would, right? So, and then I say,
Love it.
isn't 3 weeks a long amount of time to be on an antibiotic? And I said, also, I don't think it's bacterial. And she said, well, my patients get good results on these antibiotics. I'm thinking, I got to get out of here.
Oh
And
my
mind you,
God.
she's not getting paid for the surgery. This particular practice, Atrius Health, they salary their surgeons, but
Right.
she knows surgery, so that's what she wants to do. So I make a mental note to get out of there. So I agree to take the Flonase for my hoarseness and just the Flonase. And so I get back home and literally I'm on my bike. It literally takes me about 10 minutes. By the time I get home, there's already a note, a message on my home machine scheduling this CAT scan of my sinuses, right?
Oh, perfect.
So
Perfect.
I think, well, I'll just ignore it. No, no, no. They call back twice. And I think, well, I guess I got to call them back because, they actually had already scheduled it. So I called to unschedule it. And so
Yeah,
I'm
there you
thinking,
go.
if
Perfect.
this stuff, so here I am, I go in with hoarseness and I get proposed surgery, 3-week course of antibiotic, and a CAT scan by somebody who's not making any money on any of them.
I love it.
So I'm thinking, if this could happen to me, this could happen to anybody. Uh,
Absolutely.
yeah, yeah.
Absolutely.
And I also had a background in trivia. I wrote a best-selling trivia game back in the 80s. In fact, if I thought of it, I still have a few left. I would have brought up a copy. Newsweek presents the ultimate trivia game. And, I was on Jeopardy once and everything. So, I know from trivia, right? So I had the idea, why don't I create healthcare trivia games to teach people how to avoid overtreatment
Right.
and, how to do some other stuff as well. And that's where Quizify comes from.
Wow. Well,
Yeah. So,
that's a great story.
well,
People have told me I have a good face for radio, so I probably should not go to see any plastic
well,
surgeons anytime soon. Who knows
you
how
know,
many
the, the,
unnecessary tests I'll get.
the funny thing is, John, that every founder has a story, and they're usually like, "Oh, my daughter almost died of cancer," or something.
Right.
Mine, which is appropriate given that our questions are usually often pretty amusing. Mine is actually a very funny story of how Quizify got started.
But it's apocryphal
It's
of the state of the situation where, and it's funny, you were at Atrius, which wasn't like to your point, they weren't really getting paid for the more they
No, no,
did.
no. And yeah, so
Yeah.
here are the two sort of postscripts to that. One is that I wrote this in my second book, Cracking Health Costs. I wrote it all. I didn't mention Atrius' name, but I wrote the whole anecdote down. Well, somebody that I knew showed it to the CEO of Atrius, right? And the CEO of Atrius says, we got to get this guy on our board because this stuff shouldn't be happening. So I was on the board of Atrius for a while
Oh, was that
as a
Steve
result of
Strongwater
this.
back then, or was
Yeah,
that?
yeah, Steve. Yeah,
Yeah,
Steve. Yeah,
Steve and I
yeah.
used to work together at UConn, believe it or not. So we
Is that
go way back.
right? Oh,
Yeah.
I'll tell him you said hi.
Of course, then
Um,
Optum bought them, right? Optum buy them now.
yeah,
So
yeah. Well, what happened was, Steve did
Optum
as
buys
good a
everybody,
job.
right?
What we tried to do before the pandemic was get a balance of capitated versus fee for service. But by the time the pandemic hit, we didn't have enough capitated, and all the fee for service went away. So we had to find a buyer, and and Optum, as you know, likes to buy everybody. But the other postscript for my, the hoarseness situation was, so I'm taking the Flonase. That's the only thing I'm doing. And one day I actually read the little PPI, the patient package insert. I hadn't read it, and it says side effects can include hoarseness. So then there's even a postscript to that, which is one of the
The
reasons that
circle of life.
Quizzify is so important. Is so I stopped taking the Flonase, and then I get a nasty note from Harvard Pilgrim's PBM that says, "You stopped taking your Flonase."
Oh yeah, they know. They know.
Yeah.
Yeah, adherence. So you're a non-adherent. So let me, if I can, I'll just kick it off. And I'm going to pass up the baton to Lisa and Laura. But you've written a lot about waste and unnecessary costs in healthcare, and I think your wellness a lot. You've written a lot about how the wellness programs cost more than they save. And I just wanted for our listeners, and I'm heavily biased, I have to say, because I've recently become board certified in the American College of Lifestyle Medicine. So I really believe the true way to get us out of this big healthcare conundrum eventually is prevent chronic disease in the first place. So I
Mhm.
just want to make sure you're not saying people shouldn't try to prevent chronic disease. You're just saying the wellness programs as they currently exist are not for employers, are not cost effective. Is that
Oh,
fair?
oh, oh, without question. I mean, it's without question. That's of course we want to. I mean, I have my sweatshirt on because I was just out running stairs. I mean, we absolutely need to prevent through chronic disease, but the way to do it is not to line all your employees up and have some unlicensed vendor who doesn't understand, the way false positives work, tell them that they all have various diseases.
Perfect. Okay.
Yeah,
Just
and
I
and,
get
and by
that.
the way, right, and I think much of your readership is in Connecticut, right? Yeah.
We're all over. We are all over the country now,
Oh,
actually.
okay. Well, I will tell you that like Yale New Haven is one of the worst offenders in this respect for what they do to their employees. And if you want to, yeah, hey, if you want to go sue me, make my day.
Yeah, no, I think, listen, we've all had, I ran a hospital, we had wellness programs, and I actually wanted to try it out myself, and I met with the health coach, and yeah,
Yeah.
I was, at that time, I was living on a plant-based diet, I was pretty much vegan, I was exercising pretty regularly, my weight was perfect, and I was listening to the person, I'm thinking, I think I know more than they do about it, and I'm going to ask you one more question, I promise I passed the baton here, but when you write about health literacy, which I think health illiteracy, really, where does medical education, do you have any opinion on medical education in this? Because, we don't learn, I can tell you in medical school, we don't learn anything about health literacy, but we don't learn
Right.
anything about healthcare costs, more importantly. We have
Right.
no freaking clue. That doctor who talked to you had actually no idea, I'm sure, what the cost of her 3 treatment options were, not even within 50% of what the total cost was, either for the Flonase, what it would cost, actually what it cost you, the surgery for sure, or the Flonase plus treatment options. Do you think there's a role for teaching this from the starting from medical school so physicians are actually taught about the economics of the decisions they're making?
So there's several points in there. One is that there are a whole bunch of health literacy nonprofits that try to teach doctors how to talk to patients with usually too much, not much success. I mean, I wish them the best. I'm friends with them, and I wish them the best. It's not a diss. We're the only ones who try to teach patients how to talk to doctors, um, which
Yeah,
is much
good
easier
point.
because, as you know, being a physician, you learn things and they pretty much stay learned, whether they're right or not. It takes 17 years for new stuff to come in. The second thing is, without question, they should be taught about the economics of their decisions because so many people are in high deductible plans. But the third thing, and most importantly, and I think most relevantly for your audience, is you've got a ton of folks listening whose members are not in high deductible plans. And in the case of my plan, my wife is a college professor, doesn't get paid much money, but she's got gold-plated healthcare. Like if I were to tell you that her deductible is $250 a year, you'd be impressed, right?
Absolutely.
That's our out of network deductible. Okay.
Wow.
Our
That's a great point.
zero is our in-network deductible. So I have no economic disincentive to have done any of that stuff that
Right.
she was recommending.
Got it. Lisa?
Yeah, it's interesting to listen to you talk about your experience in this particular subject on the heels of having attended a cardiologist appointment with my mother this week, right, who's 82 years old. And we're all getting older, so we're all going to be on Medicare at some point, right? And I was sitting in the exam room, and she's a smart woman, but I don't think she understood half of what he said to her. And then he rattled off like 3 more medications for her, so, which brings her up to now like 28 medications. When she told me she was on 28 medications after we had, already gone through this one time to knock it down, I was just astounded, like, oh my God, we got to do this again and go through, because nobody's paying attention to this. And the average person, I mean, doctors go to medical school to learn this. The average person doesn't know the difference between an endoscopy and a colonoscopy. And I think it's unrealistic to expect the patient to understand everything about medical care. But I understand what you're trying to do in terms of educating patients. They just want to be able to go to a doctor's appointment and have someone speak English to them and tell them what's wrong with them,
Well,
Instead, they walk out more confused, and then they don't take the medications right. And so this is I would love to hear your thought about the intersection of wellness, population health, and treatment, medical treatment, and what is the best way to do this and accomplish this better health outcome, with those 3 items intersecting.
all right. So first things first, nobody should be on 28 medications,
No
period.
kidding.
Okay.
That's right.
In fact, I believe, and John, you might know better than I, but I believe the rule of thumb is that after 9 medications, your risks of more dramatically exceed the benefits.
Yeah, it's crazy. And just to jump in, when I was an intern, I heard a lecture by a family medicine physician that I'll never forget. This was now 40 years ago. And he said the average patient he sees as a new patient is on at least 10 medications. And the first thing he does, and I swear, I'm quoting him, the first thing I do is I tell him to stop all their medications. And then he went on to say how many patients actually ended up back on any medications.
Right.
So, because you know how it starts. You take a pill for this, and then you get side
Yeah.
effects, and you got to take another pill for the side effects, and it keeps going. It cascades.
Yeah.
Anyway, sorry.
So
Go ahead.
just to add one more anecdote, and we may need to do another podcast to get everything in, but that's precisely what happened to my stepmother. She was on 12 or 13 medications, and she went into hospice, and they took away all of her medications. And unfortunately for the rest of the family, because nobody really liked her, she got better, and she ended up living for a couple more years, got out of hospice. So
remarkable,
yeah,
huh?
yeah. So let's get back to answering your question about the intersection of wellness, population health, and medical treatment. Now, what I will tell you that Quizzify does have, and yes, ideally you would like the doctor to speak English. What Quizzify does have is something called doctor visit prep kits, which you write in your symptom or whatever, and it walks you through what you need to do both before your doctor visit, how you prepare for the doctor visit, um, what questions you need to ask the doctor, what questions the doctor's likely to ask you, what drugs you're likely to get. And here are the member reviews on drugs.com for those drugs. You can also write in your own questions, and most of this information is on the in the internet in various legitimate places. But what we've done is we've turned it into a very user-friendly, focused, patient-centered format to ask the doctor these things.
Smart.
And by the way, since I'm bringing it up, I don't want to, bait and switch anybody. Anyone who wants to write to me, and they do it within the next 30 days, I will send them this gratis, just because I brought it up and I don't want to make it sound like a sales pitch.
For that. Thank you. Let's pivot maybe to the GLP-1 discussion now, because I think it's a little bit, it reminds you a little bit of the wellness programs. Now, everybody, if you listen to the manufacturers, everybody should be on these, and you should be on it forever, basically, because once you stop, you're going to gain the weight. And
right.
And listen, I'm a firm believer that obesity is the root cause of a lot of problems, which really goes back to food and nutrition, and not having no literacy in that space, not to mention the way we incentivize folks to grow stuff that isn't really helpful for us. So you go all the way upstream on this, but then you get heavy, then you get obesity, and then you get hypertension, you get hyperlipidemia, then you get diabetes, and then you have a stroke, 20 years later. So I took me a long time to learn that sequence of what happens, but it's not the way most people are taught in medical school. And all of a sudden now there's a pill for obesity, something, the holy grail, right? So let's jump into that a little bit. Give us your thoughts.
All right. So GLP-1s, our catchphrase, our strategy, the way we do this using these trivia questions, but we start out with what we call the Before Your Journey quiz. Internally, we refer to it as the Curb Their Enthusiasm quiz, because we're going through the lesser known issues around these drugs. Now, we're talking about the benefits, but people may not be familiar with Ozempic face. We got a before and after picture that'll discourage 60% of women, and then for men, the risk of erectile dysfunction goes up fourfold, and that's still pretty low, but it's a fourfold relative increase. So the idea of this quiz is that when you get done with this quiz, if you still want the drugs, it's because you're serious about your health. You're willing to put up with, the possibilities that we just talked about, some of the other risks, and we say that we dissuade the GLP curious and educate the GLP serious. It's a classic segmentation because only about 20% of people who take the quiz actually go to the drugs. So we're saving ridiculous amounts of money on that 80%, most of whom would have dropped out anyway. I mean, the dropout rate is like 30% after 1 month, 64% after 10 months, something like that. But the people who are left, the 20%, they're the ones who are not in it, to look better at the beach. They're the ones who are in it because they are genuinely concerned about their health. Now, for them, we provide a whole curriculum, a monthly curriculum, starting with managing digestive side effects, because that's one of the main reasons people drop. But then, to your point, we get into how to shop for food, how to eat food, how to order food, that stuff. And in particular, I'm going to call them lies. They're not technically lies, but the lies on the nutrition labels, where they take something like, for instance, you take Cliff Bars. The first ingredient is organic brown rice syrup. Well, organic's a good word, brown's a good word, rice is a good word. Syrup, I don't care what you put in front of that word. It's pure
So instead of high fructose corn syrup, it just sounds, it's a version of high fructose corn. It sounds better.
It sounds exactly. And in fact, there actually is now a class action against them for that particular reason. Although I might say Quizzify predated the class action. But and even you go to the nutrition facts labels. Now, when nutrition facts labels came out, they're actually very useful. But there's a political philosopher who once said that every cause starts out as a movement, becomes a business, and degenerates into a racket. And that describes the wellness industry. That describes a lot in healthcare, but it also describes nutrition labels, because the companies have figured out how to game them. And the best example of that is the trans fats. Now, trans fats, I don't care what product you pick up and what supermarket you go to, it will say trans fats 0 grams. Mm-hmm. So you might say, why are they even bothering to put it in there? They're out of the food supply. I mean, they're tiny bits, but they're basically out of the food supply. Why put it in? Well, the answer, and I had to do some real digging to find this out, The food industry insisted on leaving it in because that way people would look at the nutrition facts label and say, oh, this is healthy. It doesn't have any trans fats.
That's right.
And I could give you 5 or 6 other examples from the labels. And this is exactly the kind of thing that we teach in these follow-up quizzes because we want people to be able to transition off these drugs and gradually sort of move to the outside of the supermarket, not by lecturing at them, but by having them come up with the conclusions on their own. And then when they're ready to get off the drugs, I'm not going to tell you they're going to keep the weight up, but their odds of keeping the weight off go way up.
Yeah.
And I'll tell you what else we do is the odds. I mean, there's one particular nutrient that your likelihood of being deficient in if you're on these drugs is probably in excess of 90%, that can really come back and bite you. So I'm going to ask you folks, as cognoscenti in this industry, what is that nutrient? Yeah, see, nobody.
No,
It's fiber.
Oh,
Yeah,
right.
Americans already don't get enough fiber.
Right.
And now you're cutting down the number of amount of what they eat by 50%. The difference between a fiber deficiency and a deficiency of essentially anything else, like don't get enough protein, well, you eat more protein, deficiency goes away, right? And that's true. Like scurvy is the best example. People who have scurvy, you give them just one vitamin C pill and you see the improvement, Not so for fiber. As you folks well know, you can actually get irreversible changes in your gut as a result of not getting enough fiber. So that's one of the other things we teach.
Right.
Could you talk a little bit about maybe, do you have any like success stories or how this looks in practice, especially for those, transitioning off of the people who are serious? In my reading on this subject, it's been that's one of the biggest challenges of these drugs is, like you said, wanting people to stay on them forever. How can education, especially, if you have any stories from that with your experience, or how does education help with that, getting them off the drug at some point?
Well, that's precisely what we've been talking about is the more you learn about how to read a nutrition label, how to find the nutrient dense foods, the hazards of some people say, well, your stuff is scary. Well, yeah, it is scary because the sugar, these added sugars are going to get you, but you don't know where they are. I mean, I gave you the example of the Cliff Bar, but there's 61 different kinds of added sugars, and what the companies do is they split them up. So I'm going to name a name again. Like if you look at a bottle of Heinz ketchup, well, about a third of ketchup is sugar, but what they've done is they've split up the sugars. I think it's like brown sugar and corn, whatever it is. They split it in two so that the first two ingredients can be tomatoes and water. I think even vinegar goes before the sugars. But so you don't assume that ketchup is full of sugar. And ketchup's been full of sugar since day one. And Heinz was mixing this stuff up when he was boiling the tomatoes, and he decided it didn't taste very good. He added sugar, tasted better, added more sugar, tasted better, and so on. But now they hide them. And this happens all the time. In fact, one of the questions is we show a label of a Quaker quinoa granola bar. Quinoa, like healthy grain. Quaker. You got that really healthy looking Quaker. They make oatmeal, and oatmeal is great. So you're thinking this is a health food, and the question is, how many different kinds of sugar can you spot in this label? And it turns out there's 10 different kinds of sugar in a Quaker quinoa bar label. And we teach that kind of thing over and over again. Now, can I point to actual success stories, people who transitioned off and have not gained the weight? Absolutely not. Number one, we wouldn't hear about them. We tend to only hear about, failures. And just for the record, very, very, very few people challenge our questions or say no one has ever said we've given them incorrect information and they've been harmed by it. We have many success stories of people who say, I learned stuff at Quizzify that I had no idea about that have changed my life. We also have, including, by the way, myself, I might be dead by now if it weren't for Quizzify, because I had an abscess and a tooth. One of the questions in Quizzify is, what's the only dental problem that can theoretically kill you in a week? And the answer is an abscess, And my dentist had been doing a bunch of work, which is why I had the abscess. And I was down in Martha's Vineyard. I'm calling back to the dentist saying, I'm pretty sure I have an abscess. I think this is an abscess. She said, no. You just take Tylenol, you'll be fine. And finally, I say, look, this is an abscess, and I'm going to go back to Newton, and I'm going to sit in your office on Tuesday because that's when the endo comes in. And either she fixes this or it bursts and I go to the ER and I sue you. Which one is it going to be? So I got on the ferry and I went back up and I sat there, not for long. Actually, the endo saw me right away. She fixed it with a root canal. It took less time than filling a cavity and was less uncomfortable. And I said to her afterward, I said, and so she did say it was an abscess. She said, absolutely, it's an abscess. No question about that. So I said, so scale of 1 to 10. She said, oh, you would have been in the ER tomorrow, So Quizzify, I don't know if it saved my life, but it sure as hell saved me a bunch of teeth and part of my jaw. So we have a ton of success stories. We also have a ton of success stories, which we track very easily on people not completing the quiz and this Curb Their Enthusiasm quiz, and therefore not being eligible for the drugs, or completing the quiz and deciding not to get the drugs, which is a success because they most likely would have failed on the drugs. And it's certainly a financial success for the sponsor. So we have both types of success, but there's no way we can put them together yet.
Al, who's the typical type of individual that's using Quizzify now?
Employees of companies. We actually do very well with school districts, especially as you might imagine, colleges. In Connecticut, we've got a couple of very committed users whose employees do great. I suppose I said I didn't say anything bad about it. I said they do great. So I can mention Old Brick. I know I can mention them. It's a steel company.
Yes.
Are you familiar with them?
Yeah, they're here. They're great.
Yeah.
Progressive.
Yes.
And
Yeah.
I think that, it's funny when people talk about should employers cover the cost of GLP-1s, it sounds like the answer is, well, cover the cost of Quizzify.
Yeah, I mean, the thing
right?
is, we have our GLP-1 specific program is very simple. You pay for your journey quiz, and frankly, we charge a fair amount of money for it because they're number one. When we sign up an account, we're not doing many of these quizzes, so we got high fixed costs. But number two, they save a ton of money, and we say, look, if somebody starts this quiz and they finish the quiz and start the drugs, you don't pay for the quiz because we did not keep them off. And not only that, but we will give to them the whole follow-up curriculum gratis. So they will have the opportunity to learn how to transition off. So it's a massive ROI because the quiz costs, a fifth or a tenth of what the drugs cost. And you're only paying for the quiz if somebody doesn't start the drugs.
Interesting. Yeah, it makes a lot of sense. I think, again, the illiteracy around any of this, the illiteracy, food and nutrition in general is pretty sad. And to your point, the food labeling is just part of it. This stuff should be taught. There are countries that have taken this on at a national level, and Finland is one that comes to mind where they had a lot of heart disease, and they finally said, okay, we got to address this from a public policy point of view, and they started in elementary schools or even before that in preschools, introducing like healthy choices to kids for snacks instead of sweet stuff, carrots and freaking hummus. And guess what? Kids will eat the stuff if it's brought, given to them. It's a matter of, the problem is teaching the parents. And so is there a role in this, and just a segue for public policy?
Yeah.
Where does public policy fit into this?
Well, that's a really, really good question, and there's certain things that are hard to do that require money. School lunches, which are very political, school breakfast, school lunches. So I'm not gonna go there because there's no chance of me being able to influence policy. But let's go to the nutrition labels because that's a perfect example. If you read it now, like it says, percent daily value, and it says something like, fat, like is 40% fat, is that good or bad? No, you have no idea. You have no idea. It's neither good nor bad. It depends on the fat, depends on the source of fat.
Right.
And then they list fiber next to added sugars, right in the same subset of carbs. Now, if you're a biochemist, that's correct because fiber is a carb. But it makes no sense to have a two percentages in a row, one of which is bad and one is good. My suggestion, which is very simple, is you simply color code the things so that you know which
Interesting.
are the red's
Red for
green, you
bad,
know.
green for
Uh,
good.
Red, green,
yeah,
yellow, huh?
yeah. I mean,
Yeah.
how hard is that, you know? And then you take out the trans fats, and then frankly, you take out the cholesterol. I can't tell you how many products say it contains no cholesterol that are just completely full of sugar. In fact, we tell people in Quizify, if you see a packaged food that says contains no cholesterol, do not buy it because it's full of sugar.
Yeah,
Period.
that's a good point.
Yeah.
And most cholesterol is made by our liver anyway, so it's not, yeah.
Yeah. Dietary cholesterol, unless you have familial hyperlipidemia, in which case, if you even look at an egg, you know, you're going to have a heart attack kind of thing. You can eat all the cholesterol you want. It's not going to do a damn thing to your serum cholesterol.
Interesting. Interesting.
Well, I think one of the other public, well, whether or not it's a public policy option or is probably debatable, but your explanation of getting your users to use the perimeter of the supermarket versus the interior of the supermarket, which the healthy foods are on the perimeter, the primary issue is affordability, right? And if you look at most of the kids that are obese, or the school programs for feeding kids breakfast and lunch and dinner, getting the right number of meals in with the right balance of everything, and being able to afford the products on the outer perimeter are probably the most challenging issues that individuals face in terms of being able to eat healthy. Do you have any recommendations for your users, particularly those that have those affordability issues with the perimeters around how they manage that?
Yeah, I mean, I wish I could have a magic bullet. I've got two observations. One is that when I was a kid, and Consumer Reports would cover, it wasn't called junk food back then, they hadn't invented the term, fast food, they would say, well, it's really much more expensive than eating at home. That's not true anymore. I mean, when I was a kid, you could buy a pound of tomatoes for 49 cents, and a Big Mac would have cost you 99 cents. And when now a pound of tomatoes is $4, and a Big Mac, I don't know, I don't buy them, but I think they're like $3 or something. So over the last X number of decades, bad calories have become vastly less expensive and good calories have become vastly more expensive. At the policy level, countries have put in place sugar taxes and that kind of thing, which is a great idea. Mayor, I think it was Bloomberg, who was mayor of New York, had this fantastically stupid idea to limit the size of drinks at fast food places, when a much better idea would have been to essentially put, taxes on the larger drinks, raise some money. Don't interfere with the marketplace. Don't tell people that, they can only get a 16-ounce Coke, which, by the way, used to be the big size. Now it's the small size.
Right.
So that's observation number one, is bad calories become much cheaper, and that's just a marketplace thing. And like in anything in economics, the cheaper something is, the more people buy it. Observation number two is, up here in Massachusetts, when I go to the farmer's market, I am amazed at how many people are paying with SNAP. I don't know how many other states do it, but probably when I'm in line, probably, and this is a prosperous area that I live in, that probably a third to a half of the people ahead of me in line are paying with SNAP for completely fresh stuff that's come locally, right? So everybody benefits at McDonald's. So yeah, that's the next item.
Well, I
But
think
to
the
get
taxing of the bad things is actually, so like we do for cigarettes, for example, and
Sure.
it's been shown in cigarettes to be very effective. Actually,
It's very effective, yes.
it stops teens from starting to smoke. So
Yeah.
it pays dividends in the long term.
Yes. So the thing is, I think it's going to be politically very difficult to do that. Whereas politically, I think it's very easy to do, relatively easy to do what Massachusetts did, and simply say that your SNAP benefits get accepted at farmers markets. Maybe they're not all year round, but hey, it's something, right?
Right.
But how you at least this question triggers a concept in my head that I've been mulling over for a while. And this whole concept of who pays, and who's the payer, and I think what happens is we lose sight of, and you've published this in your books, even nobody knows what anything costs, but more importantly, nobody really knows who pays what, because I don't pay if I have a hip replacement, right? I pay maybe I pay deductible or copay. My former employer, the state of Connecticut's paying something. So a friend of mine, when I was president of the house, a friend of mine had a heart attack. And I went down to see him, and he went to the cath lab, and he ended up needing open heart surgery and navigated that whole thing. And then he went home and rehab and blah, 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 right? I'd watched him gain weight over time and all this other stuff. And I said, in that time, I was really on a path to health myself. And I said, maybe we should talk about modifying your behavior and changing what you eat and activity and yada, yada. He's a good friend, so I can have a candid conversation. And he said, "Oh, it's too expensive, to eat healthily." And I looked at him and I said, "Okay, you had a heart attack. You had to take 6 weeks off of work. I'm pretty sure you're on a freaking handful of medications you're paying for every month, and you went through a few months of rehab. What did that cost you?" And somehow there's a disconnect between buying healthy food in the outside of the perimeter of the grocery store, which I think depending on what you mind, honestly, doesn't have to cost you that much, right? I mean, a sweet potato, yeah, it maybe costs you more than a Big Mac, but it's a freaking hell of a lot healthier. You get pretty nutritious, right? People don't equate the cost of bad health and sickness at all, in part because they're not really paying it. They're not writing a check, is it?
Right. So here's the best example is that the cost of car ownership per mile is quite expensive, but people only pay for their gas per mile, right? So if you were to layer in like everything into the gas tax, so the registration, the insurance, the excise tax or whatever, there'd be a lot less driving because you're paying for everything all at once. So what you're describing is precisely that, only in the area of healthy food. So yeah, I mean, I completely agree. I mean, it's and then the other thing, and this is a Quizzify thing, is that if they were paying the full cost of the unhealthy the rescue meds and the hip replacement and whatnot, of course they would eat healthier. But and this is pure economics, because healthcare is so heavily subsidized, people just use vastly more of it than they need to. It's like before the financial crisis, people were buying much larger houses than they need. People buy gas guzzling cars because everything is subsidized. The gas is, there's a little tax on it, but it's socially speaking very, very subsidized. So one of the things we teach at Quizify is we don't, people would say, well, can you teach people that if they spend money on their healthcare, that it's bad for everybody in the company because we're self-insured? And I say, no, we're not going to do that. That's precisely the opposite. We have to teach them that it's in their own best interest not to overconsume healthcare. So, for example, Americans are prodigious overconsumers of CAT scans. I myself, including that sinus CAT scan at Atrius, which, by the way, as we talked about, was capitated for me, and so they're not making any money. I've been proposed 5 CAT scans during the 30 years I've been with Atrius, every one of which would have been useless. One of which just even this year, when I got a deep vein thrombosis, and I think I got it from the xylitol in my mouthwash, because I don't have any other risk factors. Hey, folks, stay away from xylitol, okay? But in any event, so the primary says to me, first I had to convince her I had a DVT, and then once I did that, because they hate it. The doctors have these coffee mugs that say, "Don't confuse your Google search, with my medical degree." But no, we have it right in Quizify in that doctor visit prep kit. It says if you have pain and stiffness in one calf, that's actually much more serious than having it in 2 calves. So finally, I convince her, to get an ultrasound, and so she gets the ultrasound, and I'm on my way home, and she goes from saying you don't have a DVT to she says, "Is there a pharmacy near you that's open tonight?" Because I had to start Eliquis. I got it right in front of me here. Actually, geez,
500 bucks. 500 bucks a
well,
month
not for
if you were
me, 'cause I
paying,
have
if you had to
that.
pay for it.
Yeah, if I have that, and which reminds me, I got to take one right after our meeting here, so I'm going to put it out. So then she says, "Well, you might have a microembolism in your lungs, so we should do a CAT scan." So I asked the Quizify question, classic Quizify question, classic choosing wisely question. Choosing wisely is mostly failed. How would that change the treatment plan?
It wouldn't.
It wouldn't, right? So I avoided a CAT scan just this year, just within the last X number of months. So this is what I mean. So how we teach people to avoid CAT scans, very simple. We have questions like this one. How does the radiation in a CAT scan compare to the radiation in an X-ray? And we give people choices 100 times or more, 5 to 10, about the same, or the CAT scan doesn't have radiation. About half the people will say about the same, or the CAT scan doesn't have radiation. Every one of those, when they see the right answer, is no longer going to demand unnecessary CAT scans. So
Yeah.
immediate
Isn't,
saving.
isn't, isn't part of the problem also societal, right? We want instant gratification. We want an instant answer. We want an instant fix. So, the pill down, the next pill is going to help me, right? We have something wrong with our body. Everybody's reaction is you need an MRI, you need a CAT scan. I don't really recognize that, those often don't produce the right results, right? Or, they ask for procedures to be done and don't realize that you're more at risk for getting an unnecessary procedure than you are for something that you really need, because people get hurt when procedures are done. It's just part of the.
Okay, so Lisa, let me just interrupt, because you
That's-
packed like 3 or 4 really good points into that. One, and this is another Quizify question, and this was based on a study. They sent a woman, I think she had absolutely nothing wrong with her back, no symptoms or anything, to 10 different MRI centers, and she came back with 49 different findings from these centers, things that were wrong with her. So yes to that, to the instant gratification, absolutely. And I have a personal story there, as well as some data. The personal story is that my daughter, who also, by the way, got a completely unnecessary CAT scan this was before Quizzify, so I didn't know to ask how would this change the treatment plan. She was having sort of throat issues, a lot of kind of mucus in her throat or something. So we went to see a specialist at Mass General. We wait 3 hours, and the person does the scoping thing, and it says, "Oh, well, I think we can fix this with diet, with yogurt or something like that, whatever." And then they apologized 3 times for not giving us a pill. You know, I apologize for not giving us a pill. Now, in fact, the yogurt worked fine, and she's been fine ever since. But people want that instant gratification. And the classic example, and we have this in Quizify. In fact, we have a whole quiz on overuse of antibiotics, is antibiotics, where people will demand an antibiotic. Sometimes, often like the CAT scans, doctors will often give them to people because it's much easier just to simply give it to them than to tell them why they don't need it. And oh, by the way, they're harmless. Not. So they send the person away with something. And this is exactly what we at Quizify try to avoid. I mean, there's really 2 things. One is that the teaching people GLPs are not GLPs, how to read the nutrition labels and gradually moving them to the outside of the store. And the other is teaching them how it's in their own best interest not to, as we sometimes say, just because it's healthcare doesn't mean it's good for you. And we teach that in different ways over and over again. Now, we don't originally our whole curriculum was about that, but we found that we would lose our audience because they would say, well, they're just asking us these questions to save money. So now we just sort of sprinkle them in. You remember the movie American Graffiti? Laura, you're too young. The rest of us would remember it, where Charles Martin Smith has to go get a bottle of Jack Daniels in order to impress his girlfriend. So he goes to the store and says, "Yeah, I'll have a double mint, some chapstick, a bottle of Jack Daniels, a comb, and something else." It kind of just works it in there in the middle, like the guy's not going to notice, right? Well, that's precisely what we do, is we put the just because it's healthcare doesn't mean it's good for you question sprinkled in so that people don't realize, in fact, what we're trying to do is get them to spend less money on unnecessary and expensive healthcare.
Right.
Yeah, we've said many times it shouldn't be called healthcare anyway. It should be called sick care, because the healthcare industry that I've certainly was part of for a long time is really not focused on health. It's not their core business. They don't make money that way. So
Right.
it's really a misnomer. Laura, you get the final question for the day here.
Well, thank you so much, Al. And to wrap up, we tend to be somewhat optimistic or hopeful here. And it seems like from all that we've talked about and the work you're doing, you believe in the possibility of improving our health system and outcomes and reducing some spending. So in your specific area and kind of this just population health, outcomes, wellness, education, and specifically if you want to get into GLP-1 drugs, feel free, but otherwise, take it where you want. What do you see coming for in the future in this area, next 3 to 5 years? And if you have any goals or, oh, this is what I think it should be, solution.
Well, I wish I could be optimistic. The problem is that the people with the money are the people who are trying to do more stuff. It's very difficult for lobbyists, as I learned when I was taking people out of wellness programs. It's you're overwhelmed by the spending from people who are making a lot more money by putting you in these programs. I do see some causes for optimism. The price of these GLP-1s is going to come way down. Everybody says it's not. It is, because when you get 27 different formulations on a market, one or two or three of them are going to figure out that to go after the price sensitive ones. Just like when the stock market commissions were deregulated, Charles Schwab figured out that there is a market for people who want to only pay $10 for a commission. So I think that's a really good thing. It's going to take years. The first thing that's going to happen is an oral formulation is going to come out that will probably cost half as much, but 2 to 3 times as many people are going to take it, which is going to cause healthcare costs to go up, which once again, the Before Your Journey quiz and what Quizzify does will discourage many of those people. The other good news is I think we're seeing more use of metformin, which is one of the very few drugs that Quizzify, quote unquote, endorses, where we say you should ask your doctor to get on this drug, as opposed to what we're usually doing, which is why you want to get off the drugs or why the doctor might be prescribing things inappropriately. And it's very inexpensive and quite effective in multiple ways. Is healthy food going to ever become, over time? I think we're seeing just a slight trend of folks to eat more healthy than they did in the past. The problem is that some of what they call healthy, like the artificial sweetening things instead of sugar, turns out not to be. Splenda, for example, causes leaky gut syndrome, which is as gross as it sounds. And we've had a whole quiz on artificial sweeteners. So am I optimistic? Not really. Am I pessimistic? I'm somewhere in between.
That's fair. Makes sense. And, even with that pessimism, it seems like you're, appreciate that you're doing your part. So it is.
Yeah, and let me tell you something, Laura. I'm overdue for doing my part because the company that, first of all, I was putting everybody into disease management programs, which turned out to be a crock. Then the other company that I started called Matrix Medical was just it was perfectly legal, and then we did a great job. But it was a Medicare coding sort of beggar thy neighbor company where you would raise your HCC and your risk score to get more money. It didn't add any value to society. So now, I'm adding value to society. People ask us, does Quizify make any money? And I say, well, yeah, if you don't include not paying me, well, but I mean, I'm happy to keep doing it. And we are actually finally making some money because of the GLP-1s, but I'm happy to keep doing it because it's the right thing to do for people. And everyone in the company is very energized by what we're doing. We haven't had any turnover in 7 years because people just love working there. They know they have a mission, and we get great feedback from customers.
Wow. Well, Al, thank you. Thank you. Amen to that, all of that. Thank you for joining us today. And Lisa and Laura, of course, as always, thank you so much. Thank you, Al. We want to take a minute now to introduce the new MTVA membership program. As a 501c3 nonprofit, we rely on support from our grassroots network to advance our mission of creating a value-based health system with high-quality patient outcomes at a reasonable cost. As we continue to grow and broaden our impact, we're excited to invite like-minded organizations and individuals to join our membership program. We're proud to offer 2 membership models, Ally Member and Trade Member. Tax-deductible membership contributions help us enrich the healthcare environment with quality content, including this podcast, and robust platforms to fuel discussion, collaboration, and advocacy that lead to groundbreaking solutions. For more information, including a full list of benefits offered, visit our website at www.movingtovalue.org/trade-member. The link is also in the episode description. Thanks again for listening and for being part of this important movement.